I went into medicine because I wanted to have a tangible way that I could contribute to society. I wanted to have an impact on something that I thought was important, but I always knew that I wanted to do the most that I could for the most people. And so I started, as I was thinking about my career in clinical practice, I started thinking about public health, because clinical practice, your patient is an individual, but public health, your patient is actually populations. A lot of the work that I did was on HIV and HIV prevention. And in HIV, I think you start recognizing that while we know AIDS is caused by a virus, the reason why some populations are more impacted by HIV than others has as much to do with societal factors. I worked a lot globally, and globally you see that women, particularly in sub-Saharan Africa, are more affected by HIV because they don't have equal rights in a sexual situation. They're not able to negotiate safer sex, or they may not be able to earn an income and have to sell their bodies in order to put food on their children's table. These underlying social factors, poverty, lack of access to information, gender status, etc., that are the kinds of things that had an impact. And so again, I started thinking about how could I have the greatest impact on HIV, on health, and more broadly, and it's kind of what led me to CARE. In some ways, I felt like being somebody who wanted to decrease death and dying, what better way to do that than to eliminate poverty, which is, after all, the biggest killer of people around the world in the end.
Dr. Gayle, you came to CARE in 2006 and you changed it from an organization doing traditional giving philanthropy into more of an organization focused on eradicating poverty through a different way. Tell us about that and why you made that decision.
If you really want to have a long-lasting impact on poverty, you can't just attack the consequences, people's basic needs, that's clearly important, but that you also had to look at root causes and looking at some of the things that keep people, in particular populations, mired in poverty. We also recognize that if you could change the life of a girl or woman, you didn't just have an impact on that individual. That really created catalytic change for families, for communities, and ultimately for societies, because when you bring girls and women into the equation, you bring a different kind of balance. You bring a different voice. Girls who are educated will have a different future. Their children will have different futures. And you can really start kind of intergenerational change.
Isn't it also time to invest in little boys?
So our programs aren't only focused on girls and women, they're focused on whole communities. Our goal is ultimately to eliminate extreme poverty for everybody. And in the end, what we're hoping for are societies that are balanced, not more girls and women, not more boys and men, but societies that really allow all people to realize their full potential. But we know that girls and women are starting further behind. And so therefore, it's important that we make sure that they're able to, start the race on the same footing as boys and men.
Do you have a favorite story from attempting to bring men into the equation in a particular place where your organization has worked?
Well, I can give an example in a program that I just visited not too long ago in a country in West Africa. And there we're engaged in programs with what many people would call microfinance. Women develop businesses, they develop income, they're able to put those resources back, make larger loans, their businesses grow, and they use those resources, as you said earlier, so much of it goes back into the family. And in the process, men also change in the way that they view their wives. Now, the wives are no longer burdens. They are no longer seen as somebody who doesn't have value. They're bringing value into the family. The women talked about how it gave them confidence, how they felt better, how they were able to secure their children's education. But the men said that it made a huge difference for them because they saw their wives differently. In this area, there was a lot of domestic violence. Domestic violence rates dropped. Men said that they no longer saw their wives as somebody who they would brutalize or take advantage of. They had a whole different sense of respect for their wives, and they talked about starting to share in household duties. And one of the men said he had now started a club with other men to help them to understand what it means to support their wives, because their wives were working, they were working, so they started doing household duties that earlier on they might have been laughed at for taking part in.
And all those changes came about in a microfinance intervention where these women were making money, bringing in income for their
They're
families.
bringing in income, but also getting skills.
What advice would you give to a young woman just graduating from college on where to find the path where she can make the greatest impact?
Well, I think everybody can make a huge impact in so many different ways, depending on where your passion is. And what I like to tell young people, first and foremost, is follow your passion. Do something that inspires you, that makes you feel excited, because I think if you feel excited and really motivated by something, then you're going to have a huge impact.